Acid reflux disease is a very common condition here in the United States.
The chest pains I was experiencing would wake me up at night. It wasn't from anything that I had eaten 2 hours before, because I would eat dinner at 8 o'clock. I would sit up in bed thinking, if it's acid reflux, it will go away if I sit up instead of laying down, but that didn't help.
It is well documented that chest pain may be the sole presentation of acid reflux in some subset of patients.
I did end up in the emergency room thinking I was having a heart attack because the chest pain was so severe. So that's when I went to see Dr. Abiodun.
When I saw her, she was having chest pain, and after a consultation in the office, we determined that other causes of chest pain ought to be excluded. We proceeded with upper digestive endoscopy that demonstrated a rather normal examination of the esophagus, but some non-specific irritation in the stomach lining.
I didn't feel anything when I had the endoscopy. I went to sleep. While I was asleep, they put a tube down your throat, and I didn't feel any of that. I didn't have any throat pain, and I woke up and I didn't hurt anywhere. I felt like I had been sleeping for 8 hours.
We tend to treat continuously until we get to a point where the patient is comfortable, and at that point we can advise the patient take the medication as needed, what we call on-demand therapy. A good example is Saturday night. You have a big dinner, a couple of wine. If you anticipate that, it may be worthwhile to take the medication in the morning, perhaps on weekends for patients who are having less symptoms.
After the procedure was done, I was properly diagnosed and prescribed the correct medication, and I feel better, and my quality of life is a lot better. I don't have to worry about waking up in the middle of the night with chest pain. I'm active today. I'm a Zumba instructor, spend lots of time with my family. I work a full-time job, and I feel better.